afternoon, Winnebago community, Winnebago membership, Winnebago workforce. This is the weekly COVID-19 update for the Winnebago tribe of Nebraska. And I wanted to start off by saying that we're learning to live during this pandemic, and how that's important to take care of yourself, take care of your mental well-being, your spiritual well-being, and your happiness, how that's going to bring us good health too. So how things are opening up, our casino is open, and our class 2 today we made a motion to get those open too. And how it's also important to remember to practice those safety precautions. And so I wanted to thank everyone on all your efforts, from the community members all the way up to our upper management and everybody else who has had a hand in all the efforts towards this. And with that, I want to move the weekly update along to our first presenter. Thank you.
Thank you, John. You always have good words for us. So good afternoon, Winnebago community. I guess it's kind of hard to believe that it's already halfway through the year. I'm still in awe of all the great things that we've been able to pull together for our great community and people that we are serving in many of the areas in short amount of time. Like John said, we're still learning. I know there have been many hiccups in many areas, but at the end of the day, we are trying to meet the basic needs of our people through the vast amount of programs that are working together to help one another. I know sometimes it's frustrating because we want immediate results, but sometimes it just takes a little bit of time and to slow down and just really enjoy and appreciate things that we have. I know that the Winnebago homecoming celebration has been on everyone's minds. I know we've all been praying for answers, for direction, from the Creator and including myself. Sometimes I wish I could put everybody in a bubble, but our community members are starting to leave our community to play games, sit in restaurants, go on vacations outside of Nebraska. And so we need to try to figure out how we can start to live our lives in the safest manner we can. So I just want to let everyone know that the Winnebago Public Health Department has been looking at this and trying to proceed in the most safest way that we can, and to remind people that as long as everyone's wearing your face mask appropriately, the risk is low. It's not zero, but it is low. And so we'll be working with the Powell Committee to make sure that we are at the gates, taking temperatures, distributing masks to those that arrive without one, limiting the entrance to only one, not allowing people to just drive through. We're going to be working to outline the capacity for the event and performing inspections at the time of food prep. And so all of those things are also in line with what other measures are happening at the Nebraska Public Health Departments across the state for any event or gathering. And so now with that being said, I will start this week's presentation. So looking at Nebraska, there has been a total of 198,069 people tested, with 20,425 of those being positive, 177,410 are negative, and Nebraska has seen 282 deaths. Residents that have tested at the 12 Clans Unity Hospital or at the mass testing event has yielded about 348 tests, and out of those, 59 have been positive, leaving about 275 negative and 14 that are pending results today. Here in Winnebago, we have seen a total of 428 people tested, 74 have been positive, and out of those, 66 are recovered. There were 351 negatives, 3 that are still pending today, and we've had 3 deaths. We want to continue to remind people to take precautions by practicing hand hygiene and respiratory precautions. We outlined last week some of the services that are starting to open up again, and I will be checking with each director weekly to determine whether we back off, stay the course, or increase. So self-care continues to be important, as John has described. probably now more than ever. I know that it continues to be scary during this time, and the Winnebago Public Health Department continues to try and be supportive of our people. If you're struggling with any issues and want to talk through some things, please call 402-878-2911 to schedule an appointment with one of our therapists. If you're having some neck, back, or overall skeletal issues, there are still openings for the chiropractic clinic on tomorrow on the 10th. And then again on the 31st, so just give Nyla a call to schedule your appointment. Dental is still doing emergencies only. It looks like our equipment should be in hopefully this week, no later than next week, so we can start taking appointments the week of the 20th. Optometry is still open for emergencies. We have started taking appointments. Just remember that we've had a significant wait list, but we're working on getting everyone scheduled as we can. So I want to thank everyone for their patience. PHN's first immunization clinic will be on July 29th and then again on August 19th. Audiology will be the 23rd and the 24th of July, and then again, August 20th and 21st. So if you need to get in for either of those, please call and set up your appointment through the PHN program. If people want to practice on the fields, you can arrange that through Josh Taylor. Whirling Thunder Wellness Center opened this week. They're the workout rooms for gym members only. It will be open Monday through Friday, 8 to 4 for adults only. We're only allowing 3 gym members per workout area, and we're allowing for 1 hour for our vulnerable population from 3 to 4, and then we're doing a deep clean at the end of the day. The pool is open as well for lap swim for 2 to 5 adults. We will continue with our phase 1 for our programs, and we will constantly review, and we will of course update the people as we move forward. Some of the upcoming events this month for the health department, we are excited to have our very first virtual run will take the place of the annual Wilderness Walk Run. You can register through winnebagotribe.com and can be completed anytime from July 1st through the 31st. You can do it in 1 day or over a course of many days, either the 5K or the 7K. There's a variety of ways that you can submit through any of the variety of apps like Map Your Run and whatnot, and submit it to the WTWP Walk Run at winnebagotribe.com. If there's any community elders that wish to participate, they don't have an app, they can come down to the Land of Wellness anytime July 20th through the 24th from 9 to 11:30, and the staff can assist you and verify your attendance. Any other information, you can sure give Whirling Thunder a call. The staff are there. Pet Care Day will be again July 22nd from 10 to 5 at Land of Wellness. We are asking everyone to try to stay in their vehicles. Of course, masks will be required. They will call you up to the table. This will prevent a bunch of animals and their owners standing in line. I want to thank everyone for the great job that you're doing. I want to thank the community for all your sacrifices and the support that you've shown over the past several months. And now we will be moving into our another stage of normal, whatever that may be. And I will now turn it over to Laura Gamble, the Chief Operating Officer for the 12 Clans Unity Hospital, on the hospital updates. Thank you.
All right, thank you, Mona. Hope everybody's having a great day. I know it's pretty warm out there. We just have a few updates for you today, and we'll go over those quick. So as you know, the health department is opening, so is the hospital, and we're just trying to slowly start things up again. And of course, there's people are needing some physicals for school and checkups. So preventative appointments for patients are available starting July 27th. We are going to take extra measures to ensure your safety. There's going to be extra cleaning measures, you know, social distancing. As more people come into the facility, we've got to remember that we need to social distance, and we're going to try to help you with that. Maybe remove some chairs so it reminds you, you know, don't sit so close to each other. The appropriate PPE, and then screening processes have been implemented, and we've been doing that for a while. So for the schools, all kindergartners, seventh graders, and incoming freshmen will need a physical, and we can start doing those. And Dan might go over that a little bit more. I know Liz has been talking to Dan a little bit. Any student transferring from out of state will need a physical. Returning sophomore, juniors, and seniors will not need physicals. And then students will also need vision screens. And that can be done in the outpatient clinic. But if they need glasses or further evaluation, then you'll need to make an appointment with the optometry clinic. Well, child appointments and vaccinations, regular and routine appointments for children should be kept and are necessary. And like Mona said, the vaccination clinics will start up again, but we do want you to, we're gonna try to do well people in the morning, and then maybe those that are sicker in the afternoon in the clinic. So for emergency care, we just wanted everybody to be aware that staff in the emergency department are unable to give medical advice over the phone. If you feel that you are experiencing an emergency, then you should seek emergency care. We are here for you and available 24/7. If you do not need emergency care, for example, you need a medication refill or you're having some mild symptoms, then a clinic appointment is appropriate and can be made for the next day. We wanted to share something really exciting with all of you. It's a new program that we have started here at 12 Clans Unity Hospital, and it's called RQI, or Resuscitation Quality Improvement. And for decades, the CPR training standard for healthcare providers has been basic life support, with requirement for participants to renew their course completion card every 2 years. However, studies show CPR skills can decay within 3 to 6 months following the training. If you don't do the skill, then you kind of lose the skill. The new Resuscitation Quality Improvement, or RQI program, aims to increase patient survival from in-hospital cardiac arrest. It will help us at 12 Clans staff and the health department in mastery of high-quality CPR skills and competency, resulting in improved patient outcomes through more frequent exposure to CPR simulation scenarios. Our facility and staff are committed to improving patient outcomes and decreasing preventable deaths from cardiac arrests. RQI 2020 provides a high reliability platform for self-directed, simulation-based mastery learning and performance, which is implemented through low-dose, high-frequency, hands-on CPR quality improvement sessions in 10 minutes every 90 days that measure and verify competency each time. And you can see the pictures at the side. We have staff, we have a station set up where staff go in and practice. The program also provides analytics that can measure individual department, facility, or system compliance. In addition, it allows for simplified enrollment and offers additional modules for learners when necessary. We are the first hospital in the state of Nebraska to utilize this RQI program, so we're really excited about that. The staff have really loved it too so far. All right, that's all we have for you today. So thank you, everyone, and be safe.
All right, thank you, Laura. At this time, we'll turn our attention to the CEO, Esther Mercer of the Winnebago Tribe. Esther.
Good afternoon, everybody. Can you hear me?
Yes.
Okay. The tribe is currently in the process of evaluating resuming tribal operations on a limited basis beginning August 3rd. And I apologize, I'm actually not ready to present. I'm sorry. Just let me get try to gather my thoughts here. Okay. The Winnebago tribe is in the process of evaluating resuming tribal operations on a restricted basis beginning August 3rd. Community guidelines for accessing Winnebago tribal buildings during the COVID-19 pandemic were presented to the tribal council and approved yesterday at the CEO report. The guidelines are in effect as of July 8th and will be in effect until rescinded by the tribal council. Community members are asked to adhere to all guidelines set forth by the Winnebago Tribal Council and by the Winnebago Tribe of Nebraska's departments. The guidelines were developed with the intent to minimize the spread of the COVID-19 virus. Please be sure to adhere to all guidelines when accessing our tribal buildings. The first guideline is that masks or face coverings must be worn at all times. The second is that community members are encouraged to use phone, internet, or other means to contact tribal offices and staff when possible. Third, meetings with tribal staff and tribal council are by appointment only. Beginning August 3rd, all visitors will be screened by tribal security officers prior to entering tribal buildings. Anyone with a temperature above 100.4 degrees will not be allowed to enter in our building. Please do not enter tribal buildings if you are experiencing any symptoms of COVID-19 or if you have been diagnosed with COVID-19 until you have been cleared by the Public Health Department. Any community member or other who refuses to adhere to these guidelines will be asked to leave the premises. In addition to our limited reopening on the 3rd, the Tribal Council had also approved the reopening of EduCare effective August 17th. That concludes this week's update for the Winnebago Tribe of Nebraska. Thank you and have a nice day.
All right, thank you, Esther. And just for FYI to everybody, there was a miscommunication between me and Esther. I was actually scheduled to do that, and so I apologize, Esther, for sending that football your way and you weren't ready for the pass. But appreciate the update and thank you again for that. And at this time, we're going to turn our attention over to the Little Priest Tribal College President Manoj.
Is it Dan who is going first? From the Winnebago Public School?
We got a note that Little Priest is going to go.
Okay. Well, sorry, Dan. Good afternoon, everybody. Hope you guys are doing well. I hope you had a safe and long weekend. Quick update from Little Priest Tribal College. Our graduation is set for July 31st. On behalf of the college, I want to invite all the community members to attend the first virtual commencement ceremony. It's from 11 a.m. to 1 p.m. All the information is posted on the Facebook and the college website. If you need any other additional information, please contact Tricia Wagner, Director of Student Support Services. Fall registration is open. We request the community members or any students interested to enroll for the classes to start registering. A full-time Title IV eligible students will get 2 free classes that includes textbooks. A part-time student who is Title IV eligible will get 1 class free that includes the textbooks. All eligible students will also get a free laptop or a Chromebook. So this is the exciting opportunity for the Winnebago Tribe of Nebraska community members to continue their higher education. The college reopened for employees on Monday, July 6th. We are excited to be back on the campus with strict guidelines. There is temperature checks, health monitoring questions as we enter the campus for employees. It is right now we are created a rotation for employees to be twice a day on a weekly basis. We will reevaluate as we go into the month of July and August, and ensuring the safety of all the health, safety of the employees. Again, we wish everybody a safe summer. Take care, maintain the social distance, and again, we look forward to having you guys in fall 2020 semester, which is completely online at Little Priest Tribal College. Thank you and have a good day.
Thank you, President. And once again, we apologize down here in the control room. We're getting kind of all different notes, and we just came from a different live stream, so apologize for that, President. But at this time, we're going to continue on. The Winnebago Public School Superintendent Dan Farringer. The floor is yours.
Good afternoon, everyone. Some updates from the school. Summer school did start on June 22nd. Safety measures are in place and are being followed by both the students and the staff. It's going real well so far. We've opened the weight room. That's going well. Also, the coaches have started some summer camps during the school day, during the day, and the students are doing, the athletes are doing fine, coming in, following the safety rules. Plans for the fall return to school are in progress. I will be sharing ideas with the school board at the July board meeting scheduled for next Thursday, the July 16th. The results from the survey did help develop different scenarios for the return to school this fall. As soon as the return to school plan is approved, the community will be notified through the school and tribal websites. Graduation will take place on August 1st at 2 p.m. at the powwow grounds. I want to thank the tribal council for approving this. One of the reasons we wanted to move it out there is because of all the work on the highways, and we also have some shelter if it does start raining and things like that, and we'll try something different, and hopefully it goes well and it could be an ongoing tradition. So that's where we're at. Back to the physicals, the NSA did approve that if you were a participant in athletics last year as a seventh grader, so an incoming eighth grader, incoming sophomore, junior, seniors, last year's physicals will work. Any new kindergartner, seventh grader, new student moving in from the outside, or any student who did not have a physical last year will have to have their physicals. And I believe it was Liz that I've been working with at the hospital. She's contacted me. They're trying to set up some times to make it more convenient for parents to get their kids down there for the physicals. That's the report I have for this week. Again, continue to practice safety measures and be safe. Thank you.
Appreciate it, Mr. Farringer. And once again, a graduation is set at the powwow grounds, just to confirm. Was that?
Yes.
Okay. All right. Thank you for that update. At this time, we're going to turn our attention to Winnebago, Mayan Beltran, with his weekly update. Mayan.
Good afternoon, everyone. Thank you for your time, and just an update from Winnebago Casino Resort. Everything has been going very well with our opening, our phase one. Actually, we just received an award today from the American Non-Smokers' Right Foundation, and congratulating and thanking Winnebago Casino Management and the Winnebago Tribe of Nebraska for their safety guidelines with no smoking in our first phase of opening the casino. So thank you for that to the American Non-Smokers' Right Foundation. With that being said, we have had no new positive cases. We've had the two that happened early on, and everybody that was in contact or around has all come back negative or have been back to work. So as was mentioned earlier, you know, our safety guidelines of required masks for the protection of our team members and our guests is proven that it's working for us. So we're very proud of that.
Okay.
So announcement on, we are submitting approval for a phase 2 opening. Now, once that gets approved, we'll make announcements, but that has to do with expanded hours of operation, expanded amenities, some changes within the casino operation to better serve our guests and our team members. So be on the lookout for that. As soon as we get the approval, we'll make the announcements publicly. So that'll enhance our gaming in our industry for our guests and for our team members out here at Winnebago and for the tribe. So that's all we have to update at this time. Thank you very much for your time, and congratulations to all the graduates this year.
Thank you, Mayan, and congratulations on that award. That's definitely something to be proud of. At this time, we're going to turn our attention to Sam Burrish, the HoChunk Inc. Communications Officer. Sam.
Good afternoon. Thank you, Garen, and thank you, everyone. I'd like to start out today by thanking the community's healthcare and frontline workers. We can't express enough gratitude for all the work that's happening And employees across HoChunk Inc., including those working across the country, have heard about the community's response and the partnerships and the proactive efforts. So they wanted to show appreciation, and they sent us photos from all over, and we put those together into a short video to express that thanks. And Garen, if you've got available, please go ahead and roll that.
Oh, yeah. Yep.
Very nicely done, Sam. Thank you.
Well, I wanted to say thank you again to all the community's healthcare and frontline workers. The video is available on the HoChunk Community Impact and Engagement Facebook page. The one other update I have today is new hours for our Pony Express convenience stores. These began this week. The Pony Market in Winnebago is now Monday through Friday, 7 a.m. to 7 p.m., and Saturdays and Sundays, 9 a.m. to 5 p.m. The Winnebago North location is now Monday through Sunday, 7 a.m. to 10 p.m. And of course, as always, store hours for those in every location are posted at the locations and on their respective Facebook pages. Those are all the updates I have for today. So with that, I'll turn things over to HCCDC.
Thank you, Sam. Well, good afternoon, everybody. Again, my name is Michelle Parker. For those of you who don't know me, I work for HoChunk Community Development Corporation. I'm a community projects coordinator, and I'm standing in for Brian today. I don't have very many updates, but I just wanted to reiterate a few things that Brian's probably already shared with you all. We have the farmers market every Wednesday from 1 p.m. to 6 p.m. Located at the Market Pavilion in the HoChunk Village. Interested vendors can contact Vince Bass or Brian Mathers. Farm to family produce box distribution will be occurring tomorrow, as we have been doing every Friday since I believe that last week in May when we started. Normally we start around 8 a.m. until all boxes are distributed. We get every week have been getting 240 boxes delivered. The location will be at the Market Pavilion. And if you could spread the word for community members to enter the pavilion area from the east, and it kind of eases the traffic building up on the highway. So if they can just come around the Market Pavilion and enter that behind the DG from the east, it's a little bit easier. And lastly, this, I don't know if Brian had shared this with the community, but I have been getting requests to use the Woodland Trails Round Room, and that Round Room is not available to the public until we have our restrictions eased in the community, but it's been closed since March and will remain closed until further notice. And that's all I have. So you have questions, you can contact HCCDC at 878-2192, and stay safe and healthy, everybody. Thank you.
Thank you, Michelle. Appreciate it. At this time, folks, we're going to try to turn our attention. Do we have the Census Bureau? Harmon, are you on the call? Are you able to speak through the microphone?
Yeah, I was able to get on the call. I don't know if you can hear me or not.
Yes, Harmon, you can address the Winnebago viewers. They are on, and the floor is yours.
Okay, thank you, Garen. I'm on my phone. I couldn't get in on the computer for some reason. It prohibits me from using the government computer on these calls. But thank you for being involved with the census and for promoting it, Garen. Last week, I understood that you promoted jobs, and we are still looking for people to work up there. We want to keep jobs in the community. It does pay well. I think it's about $16.50 to $18.50 an hour plus mileage. I think that's at 56.5 cents per mile. You have flexible scheduling, so if you're working during the day and you want to pick up some hours over the weekend or at night, you can do that too. But our window is closing because training is going to start middle of this month and towards the end of this month for enumerators. And those are the people that are going to go around and start knocking on doors come August 14th. Now, a way to avoid someone knocking on your door is to fill out that questionnaire, that packet that should have arrived at all households. And I've been told by the area census office that those packets now are 100% complete in Winnebago, and that every address up there should have received a packet. So if you did not get a packet at that residence, please get a hold of me so that I can get a hold of the people that need to fix that. We're urging people to respond by phone. You can still mail in that questionnaire, old school, but this is the first year that we're using the phone and the internet. So if you have access to mobile devices, internet, we encourage you to use that. It takes about 10 minutes, the whole packet questionnaire. It's very quick, pretty straightforward. Let me see, currently Winnebago is at 30% response rate, and that's gone up significantly since we dropped off those packets a few weeks ago. I think it's almost doubled or close to doubled that. And we're seeing it go up a little bit every day. I think more people are maybe looking through their junk mail. I know that sometimes stuff gets lost in my house too. But if these questionnaires are not filled out and people start coming around and knocking on doors, that's going to happen August 14th. Now, all the census takers will be identified. They'll have a valid government ID, their photograph, Department of Commerce watermark, expiration date, and they will be wearing PPE. Okay, and they're going to be following all local public health guidelines. So that means whatever Winnebago implements, the census employees will follow those guidelines. They'll also follow the CDC guidelines. And all census takers must complete a virtual COVID training on social distancing protocols and other health and safety guidance before beginning their work in neighborhoods. So before they even go out, they have to accomplish all this before they start knocking on doors. If no one is home after they start knocking on doors, the census taker is going to leave a notice of their visit and how to respond online or by phone or by mail, like I spoke about earlier. But people are encouraged to cooperate with census takers to ensure that everyone who is living in that household after April 1st is counted. Now, we want to include specifically the individuals living in that house, but babies and children living there. And that includes foster children, During the last census, that population was dramatically undercounted, and not only on reservations, but throughout the country. So we're making a specific pointed effort to target that populations. You want to include your roommates, anyone staying with you, whether they're family, friends, doesn't matter. Anyone staying with you at that time on April 1st should be counted. We're not including college students who live away from their address. So if they're down in Lincoln, they're going to get counted in Lincoln. If they're in Kearney, they'll get counted in Kearney. If you're in the armed forces, you'll be counted where you're stationed. If you're in a nursing home or hospital, it'll be counted there. And if you're incarcerated or at a detention facility, you'll be counted there. But the key is to get everyone counted. There's $675 billion available. It's up for grabs. And that's per year for the next decade. And so after you do the math, it boils down to about $1,800 per person per year. So if we miss 10 people in Winnebago, then over the course of that decade, we're going to miss out on just under $200,000 for the community. And that money goes towards social services, education programs, infrastructure, things like that. So please, please, please urge your family, your friends, community members, colleagues, coworkers, anybody you have contact with to fill out that census. So thank you for your time, Garen.
Appreciate it, Harmon. And we appreciate the update here. And folks, Harmon, just a quick question here. That virtual job fair, is that still going on?
We were trying to figure that out, and we haven't established a time or a place or anything like that as of yet, but we're hoping to find a place where we can have some people come in and apply for jobs. We'll have some recruiting assistants there that can walk you through the process online and get you set up and ready to go so we can have you working up in Winnebago in about a month. Thank you.
All right. Appreciate you jumping on, Harmon, and look forward to working with you to get everyone counted. And as just kind of re-emphasizing, make sure if you have the opportunity to make sure to fill out that census. And if you're looking for a part-time job or a full-time job, to apply online today at 2020census.gov/jobs. At this time, we're going to turn our attention on over to Emily, with the communications manager for the Winnebago Comprehensive Healthcare System. Emily.
Thank you, Garen. So we're going to do our Q&A portion of today's community update. These questions were all submitted by community members and are questions for the health officials. So the first question is in regards to the powwow. Is the powwow committee working with the health department for the powwow? On a scale of risk level, what would be the health department say that the powwow would be? Do you recommend we attend or not attend? Mona, can you answer that question for us?
So I haven't been able to meet with the powwow committee once. I'm awaiting some items to review, such as the agenda and some other requested items. We will make sure that we get a table that kind of shows the different risks on a scale from 1 to 10. So what the powwow would be considered is a moderate risk. So what does that mean? That is probably equivalent to going to the beach, shopping at the mall, or working a week in an office building. So some of the other, just to give you a parameter, so some of the, what would be considered like a lower risk example would be like grocery shopping, walking like in a busy downtown area, or even sitting at a doctor's waiting room. And some of the higher risks would be like eating inside a restaurant, playing basketball, going to a bar. So those are some of the examples. So if you're wearing your face mask appropriate, like I said earlier, the risk is low. It's not zero, but it's still low. But again, it's up to the individual. So just because it's there doesn't necessarily mean you have to attend or participate. So all we can do is try to present it in the most safest way we can possibly have it.
Thank you, Mona. Along those lines, the next question was what precautions are in place for the powwow? And I know you briefly touched on this already, but can you reiterate what the precautions are?
Sure. So the Winnebago Public Health Department will work with the powwow committee to make the gathering as safe as possible. We'll be taking temperatures at the gate. We can distribute masks to those that arrive without one, limit the entrance to only one, not allowing people to drive through. We will outline the capacity for the event, doing inspection at the time of food prep. So these are all things that are already in line with other measures that other Nebraska public health departments have been putting into place for other events and gatherings throughout the state.
Great, thank you so much for that information. The next question, I don't know if you'll be able to answer this, Mona, but do you know if food vendors will be allowed at the Winnebago powwow?
It is my understanding that no, there will not be food vendors allowed at the powwow. My understanding is that there will only be food allowed out of the cook shack. And then I've already asked Monica out of the environmental health office to perform inspections to make sure that those that are preparing and serving the food have proper precautions. All of the food we've asked to be prepared in containers so that people can just pick them up and leave, similar to how it's done at like a takeout restaurant. We're waiting to see who is placed in charge of the meals so that we can work directly with them. So that information I'm sure will be forthcoming.
Great, thank you, Mona, and thank you for your participation and knowledge and all of the planning for that as well. So the next question is in regards to the 4th of July fireworks display. The question is, has the Winnebago numbers for COVID-19 cases gone up since the 4th of July fireworks?
So our last positives were reported on the 4th of July. And so we haven't had any positives since then. Of course, we still have, I think, 3 pending as of today. So typically what we've noticed is that that we might see some positives or coming back perhaps this weekend. Typically people start having symptoms about 5 days post-exposure. So we'll just be watching and hopefully everyone has taken their precautions that they've been told this past weekend, and they kept it to, you know, the people that they've been around pretty much this whole time. And so we're just hopeful that that's been occurring.
All right, thank you for that answer. The next question is, will increased testing start at 12 Clans Unity Hospital, and how many tests will be performed a day? So Laura, can you answer that for the hospital?
Yep, I can do that. So yeah, we are looking at increasing our testing. And right now we do have testing available every day from 9 to 12. So we can test about 20 people a day. As we move forward, you're going to be able to make appointments at the clinic, and we'll have more out on that soon, probably at the next live stream. But we do want you to still come to the drive-through testing. And so you'd be able to make an appointment. And if we need to add time slots after we see how many people, you know, want tested or need tested, then we will do that in the future. We just are evaluating it on a weekly basis.
Great, thanks, Laura. And then do you know how many or who testing will be available for? Is it available for anybody that walks in the door, or can you answer what the parameters are?
Yes, anybody could get a test, but we'd like you to call, make an appointment before you just come to the hospital. And then we will get you registered, and then you can just go through the drive-through is what how we would like to handle that.
Great, thank you. And that, just to clarify, Laura, that's the outpatient clinic, right?
The outpatient clinic, yep. Calling the outpatient clinic, and they'll have the MSA or the nurse will be able to set you up with an appointment.
All right, great, thank you. And so that wraps up their questions for today. Just a reminder, anybody that has questions regarding any of the healthcare services or health department services can leave your questions on the chat box feature of the live streams or email covid@winnebagotribe.com, and we will do more information next week as we get them, and we'll also be presenting more information, as Laura mentioned, on the upcoming testing. So that wraps up today's Q&A. Thank you all for your time. Thank you, Mona and Laura. Throw it back to you, Garen. Do you have any other?
No, Emily, appreciate the question and answer. And then, as you know, today we announced the Winnebago Veterans Association announced the 154th annual homecoming celebration. It's going to be a one-day, starting at 6 a.m. flag raising, and then go into the evening time. So it's going to be open. There's going to be some safety measures, as was discussed today. But if more information will be in the Winnebago Indian News, as well as the Winnebago Tribe's Facebook page. We appreciate everybody for joining us here today. We want to thank the Census Bureau, Harmon, for your time and effort for getting that information out to us, and then also all the entities, the Winnebago tribal entities, for jumping on and giving us your updates as well. You folks stay safe out there, and we'll see you next Thursday for the weekly COVID-19 live stream. Have a good day, and we'll see you down the road. Thanks.
Thank you.
Thanks, everybody.
Thank you.